Good morning, Colonels. I'm Mrs. Miller, and I'm here with the school counseling team, Mr. Ogles, Ms. Hoffman, and Ms. Rowan. Today we'll be doing our annual suicide prevention training. Starting this school year, the Kentucky Department of Education mandates that all Kentucky high schools do a suicide prevention program 2 times a year, so this will be our first training.
We're not only doing this training because the law says we have to, we're doing this training because it's important to talk about mental health and suicide. We're doing this training because suicide is the second leading cause of death in the United States among people the ages of 15 and 29.
We are doing the training because statistics show 4 out of 5 people who attempt suicide talked about it beforehand or show various warning signs. So we think that's very important that you all learn about the warning signs and what you can do if you or someone you know needs help.
Suicide and mental health are tough topics to talk about, and we understand that talking about either can be challenging and may bring up all sorts of emotions. Many of us have experience with one or both topics. Here at Dixie Heights, we want to create an environment where people are comfortable talking about mental health and asking for help when they need it. Some of the Dixie Heights Hope Squad members are now going to talk to you about suicide prevention. I'll see you all again when they are finished.
Good morning, Dixie Heights. I'm Bella Phelps, and I'm a senior Hope Squad member.
Hi, I'm Cam Nobles, and I'm a sophomore member of Hope Squad.
Good morning, Colonels. I'm Bridget Bennett, and I'm a senior Hope Squad member.
And I'm Owen Caudell, a senior Hope Squad member. Hope Squad is a student-led group that is focused on suicide prevention and improving the overall mental health of the entire school. Hope Squad is made up of students in all 4 grades, and we're here to help anyone that needs it. Today, we're going to be talking to you about the risk factors of suicide, the warning signs of suicide, and what you can do if you or someone you know needs help. Cam is going to start by talking about the risk factors for suicide.
Risk factors are traits, events, or characteristics that increase the probability that someone will consider or attempt suicide. Risk factors include depression or mood disorders, substance use and abuse, stressful life events such as breakups, divorces, or any other traumatic event, physical, verbal, emotional, or sexual abuse, social isolation, access to firearms or other lethal means, previous suicide attempts, family history of suicide, exposure to the suicidal behavior of others. It's important to note that just because someone may show one or more risk factor for suicide, this does not mean that they will consider suicide. People can experience stressful life events and never even consider suicide. But being aware of the risk factors and also knowing the warning signs that we are about to discuss can help identify people that may need help. Bridget is now going to talk with you about one type of warning sign.
3 different types of suicidal warning signs: verbal, behavioral, and situational. And I'm going to talk to you about the verbal warning signs. Verbal warning signs are things that people say and can be directed or indirected. Direct warning signs are things people say where they directly talk about suicide. Example of direct verbal warning signs include someone saying, "I wish I were dead. I'm going to end it all. If she breaks up with me, I'm going to kill myself. I'm going to commit suicide." Indirect verbal warning signs are things people say where suicide is implied but is not mentioned. Example of indirect verbal warning signs include someone saying, "My family would be better off without me. I wouldn't be around much longer. Who really cares if I'm dead? I'm tired of life." Remember, when these types of things are expressed online or in text, whether typed out or shared in photos, GIFs, or memes, they are still warning signs that need to be taken seriously. Anytime someone talks about feeling hopeless, being a burden to others, feeling trapped, or experiencing unbearable pain, we should see the warning signs and refer them to a trusted adult for help. Bella is up next. She is going to talk with you about other types of warning signs.
Behavioral warning signs are certain behaviors people display indicating that they may need help. These behaviors include giving away their prized possessions, losing interest in activities you once enjoyed, isolating yourself from friends and family, neglecting your personal appearance and hygiene, an abrupt change in personality, someone just isn't acting like they normally do. Visiting or calling people to say goodbye, new or increased substance abuse, poor coping responses, change in sleep habits. This can be sleeping too much or too little, acquiring lethal means such as firearms or pills, relief, or sudden improvement in mood. It's important to talk about the last warning sign. Sometimes a person considering suicide may seem to suddenly be in a better mood. While it might be tempting to assume everything is okay and that they are no longer at risk, this sudden relief sometimes is a signal that they have made the decision to end their life in the near future, so they feel like their pain will be over soon. If you notice this type of improvement while also being aware of other of them having warning signs, it's important to reach out to a trusted adult immediately. The next type of warning signs are situational warning signs. These are situations that occur that may be out of a person's control but can cause feelings that are overwhelming to manage. While not everyone who experiences these situations will be suicidal, being aware of these situations can help us be on the lookout for other warning signs. Situational warning signs include humiliation. This includes being suspended or expelled, being the victim of catfishing or sextortion or being bullied, getting fired from a job, being the victim of a crime. Suicide is also an impulsive act. People who attempt suicide often do not want to end their life, but the pain they are feeling, they want to end. When situations cause pain or humiliation, suicide might be seen as an option, so be aware that in these circumstances, these are warning signs that we must pay attention to. Now that we've discussed the risk factors and warning signs, Owen is going to talk about what we can do to help someone who may be thinking about suicide.
Everyone has heard of CPR, the medical intervention that stabilizes people who aren't breathing or are struggling to breathe until the person can reach a hospital or another form of urgent care. Similarly, QPR is an emergency mental health intervention for people at risk of suicide. The goal of QPR is to identify and interrupt an emotional or mental crisis while directing the person to get help. Like CPR, QPR is designed to increase the chance of survival in the event of a crisis that may help prevent suicide. QPR has 3 steps. The Q in QPR stands for question. If you think someone may be considering suicide, ask them questions like this. Are you thinking about suicide or wanting to kill yourself? Don't say, do you want to hurt yourself? Because this is asking about self-harm, not suicide. In these situations, it's best to be as direct as possible with your questions. The P stands for persuade. In the event that you are helping someone who is suicidal, you are trying to get them to a trusted adult, which is something that could be a matter of life or death. Say, will you go with me to get help? Or will you let me go get help for you? If persuasion doesn't work, you'll need to get the help of a trusted adult immediately. In some cases, this may mean calling a crisis hotline or 911. The R in QPR stands for refer, and this means that you find the right resource to step in. Ideally, you are able to escort the person to a trusted adult, a school counselor, principal, or teacher. This is a crisis situation, and it's important that you find an adult who can help. It is our job to refer. It is not our job to act as a counselor or therapist. QPR is something that should be used if someone is suicidal, but there are also things that we shouldn't do when helping someone who is suicidal. Avoiding arguing with the person who is suicidal. Do not treat the situation lightly. Do not promise secrecy. Avoid offering simple solutions. Do not leave the person you're helping alone. And do not try to be the only person to help. Today we went over risk factors, warning signs, and what you should do if you know of someone who is suicidal. Let's all check in on another, and if you have concerns about someone, talk to a trusted adult. Ms. Hoffman is now going to wrap up today's presentation with a bit more information.
Hello, Colonels. It's Mrs. Hoffman here again. Your Pride teacher is now going to hand to you a yellow mental health referral form. Every student needs to complete this form and return it to their Pride teacher. If you put down that you have an immediate mental health concern that is urgent, someone will call you down to talk by the end of the day today. If you would like to talk about your mental health, but it's not urgent, somebody will call you down in the next couple of days to talk. Please be sure that you write your name legibly on the form. It is totally normal to be sad sometimes, and it's completely normal to be upset when something negative happens in our lives. We're all going to experience ups and downs, and not one of us is happy 100% of the time. But when we start thinking about not wanting to be here anymore or about killing ourselves, that's when it's time we need to get help. Regardless of what's going on during the school day, your safety is our top priority here at Dixie Heights High School. In the event that you or someone you know is feeling suicidal at school, reach out to a trusted adult immediately. Find a school counselor or a principal or a teacher. If this happens outside of school and you don't have access to a trusted adult, you can call or text the National Suicide Lifeline 24 hours a day, 7 days a week. The Lifeline is open every single second of the year, regardless of weekends and holidays. The number for the National Suicide Lifeline is 988. If you text or call 988 at any point, you will be connected to a licensed crisis worker. If you or someone you know is seriously thinking about suicide, you can also call 911 or report to the closest emergency room. We care about each and every one of you and want you all to be healthy and safe. Please reach out if you need anything. We're here for you, and you are not alone.